Dr. Birx, thanks for joining us. Today in Indiana, we saw the largest single day reporting of cases, 6,654. It seems that the virus is out of control in our state and across the country. How do you see it?
Every place across the country, and thank you. It's great to see you again. And sorry to see you under these kind of circumstances. Last time we were together, Indiana and Indianapolis were in a very different place. As the north part of the country cooled, we saw a dramatic increase both in infections, cases, and now rising hospitalizations, which will lead to rising fatalities. And now is really the moment to act across Indiana right now, so that we can really flatten that curve together.
Dr. Birx, we expect to see some new restrictions when it comes to gatherings. Some schools are returning to remote learning. Is that enough?
What we have observed across the South when we had to control the Southern surge is the governors that put forward a mask mandate, that closed their bars, that restricted indoor dining significantly, that really asked people not to gather outside of their household, were highly effective in flattening the curve and going down the other side. And we're really going to have to continue to be aggressive in these mitigations time over time to make sure that we're having an impact. Now, I will tell you, the United Kingdom, which looks like they're starting to flatten their curve, put in a mask mandate, closed their bars, closed their restaurants, kept pharmacies and grocery stores and other retail open, but they kept their schools open too. So we're tracking them very closely because they were able to flatten their curve and keep their schools open. So we just have to really understand, as we learn from each other around the globe. Obviously, Europe is experiencing the same kind of fall surge that we are. We're encouraged that they're beginning to turn things around, which means that we can too as Americans.
Your recommendations for Thanksgiving.
So I think with the level, it's not just the absolute number of cases, it's how fast those cases and hospitalizations are rising. So it's a combination of the absolute number and the rate of rise. And with our current rate of rise that we're seeing across the area of the country, where the temperatures at night are falling into their 40s and people are moving their activities indoors, they cannot gather outside of their immediate household, because what happens when we're indoors and we take our mask off, it creates small spreading events, household by household, community by community, that's going to result in broader community spread. So because we have a vaccine coming, because that light at the end of the tunnel is getting brighter by the moment, now is the time for each and every one of us to really protect the ones that we love and protect those that we're thankful for Thanksgiving, by not gathering as a group and taking our mask off and taking the risk when we're this close to getting our vulnerable family members immunized, exposing them to virus unnecessarily.
Dr. Birx, we are hearing about treatments and vaccines from places like Eli Lilly and Company and Pfizer and Moderna. What is the outlook?
So it has to be broken down into pieces. So let's talk about therapeutics first. So with therapeutics, as we discussed, I think even when I was out there before, we have an antiviral called remdesivir, and now we have monoclonal antibodies. What do I mean by monoclonal antibodies? They're essentially giving the person what that person would generate, but it takes them 10 to 14 days. So you're giving it early. So both the antivirals and the monoclonal antibodies are most effective early. So to everybody in the state of Indiana, you need to be tested early. So make sure you're getting tested if you've been exposed, if you have vulnerable conditions. Make sure that you have access and know where to find out how to get a test. Be in contact with your local doctor, because those work early. We have a whole nother set of medications. We call them steroids and the anticoagulants and oxygen therapy. Those are for people later in disease. And then we have the most important piece in the long term is vaccination, because that's how you get to herd immunity. Now, there's two roles of vaccination. One of them is to protect the people most exposed, like healthcare workers. but also to protect the most vulnerable among us. And we know who those are. Those are individuals over 70, those are individuals with comorbidities. And so making sure that they're up first for vaccination, then the rest of us can be vaccinated to create that herd immunity that will protect the country in the long run, that will allow us to have those birthday parties, those weddings, those Thanksgivings, those July the 4th. We can have all those next year. The important thing is to make those personal sacrifices now so that our loved ones are there to get vaccinated in the new year, in December and into the new year.
And ma'am, final question. Of course, everyone wants the vaccination today. And of course, it's going to take some time. So when do you see just regular Hoosiers, the regular worker, the regular person who's not in healthcare or who is not working with those in nursing homes be able to get that vaccine? Is there a time period? Is it the spring, the fall, or maybe next winter?
Well, that's why I talk priorities. So we want to make sure that we're vaccinating Americans that we know can have the most serious outcomes to this disease that require hospitalization and that have often, in some cases, led to a fatal outcome. So when we talk about the first responders and our healthcare providers, and we want to thank them every day for the hard work that they're doing once again to save us. But at the same time, we want to immunize the vulnerable individuals. So if we don't have those conditions, if we are not obese, if we're not hypertensive, if we're not diabetic, we need to make sure that all of the other Americans get immunized first. And then we will get to us. And so let's make the priority our healthcare workers, our vulnerable Americans, and we will get vaccinated as additional vaccines become available.
Dr. Deborah Birx, thank you for joining us on WRTV and WRTV.com. We appreciate your time.
Please be safe and take care of yourself. So good to see you again.
Dr. Birx, happy Thanksgiving to you and your family. Thank you again for your service to the country, and I look forward to speaking to you in the near future. Thank you.
Very much.
Thank you, ma'am.